Hello, my name is Ralf Friedrichs. I'm an addiction recovery coach and the host of the Take Your Life Back Today show. As an addiction recovery coach, I want to share something with you. And let me be crystal clear to leave an everlasting impact upon you. Just imagine being buried alive. You're in a coffin, but you know you're not dead. You don't know how to get out of that coffin. You tried lifting the lid of that coffin, but the enormous weight upon the lid prevents you from opening it. You then try to bang on the lid to hopefully unsettle the dirt. Maybe somebody will notice and start digging their way down towards you. This is what it's like to feel at the lowest point of alcohol and drug addiction. You know you need help, you know you can't do it on your own, but you don't know where to turn. In reality, there are people standing by your grave. You just don't know that. You just think you're going to die. Usually, though, people don't think about death when they're habitually abusing drugs and alcohol. In order to feed an addiction, you have to be great at repressing the fear of death. I often ask you, my audience, did it ever cross your mind while you were abusing drugs and alcohol that maybe, just maybe, you might overdose and take something away that God had given you called life? And if that's not hard enough, you take that life away from the people that love and care for you most. Your mother, your father, your brother, your sister, husband, wife, children, even grandchildren. With this, let me leave one last thought. Don't be like the person that I just spoke about that waited and waited and waited until it was too late to get help. Instead, pick up the phone, call me at 844-405-HELP, and I promise you, I will help you take your life back, for your life is gone. Don't forget to take those slippers off at night. Don't leave them by the edge of your bed. Stick them way under the bed. That way in the morning when you get up, you'll be forced to get on your knees to retrieve those slippers. And while you're on your knees, why not utilize that time to pray to God? I choose it, Knee-mail, K-N-E-E-mail. Knee-mail is your relationship, your communication between you and God each and every morning. It's the time where you ask God for guidance, forgiveness, direction, and mercy. It's the time you thank God for food, health, clothing, home, relationships. Knee-mail should be done each and every day. And God does answer all prayer in His own time. But you need to be consistent and make sure you communicate with Him daily. And no better way to do that than when you get those slippers back from underneath the bed and put them on your feet, to utilize that time to speak to God. Put those slippers on, stand straight up, and walk with God 24/7. This is going to be a brief video. It's about the Surgeon General. He released an historic report on addiction crisis, and there'll be parts to follow on this. We've never seen this before. We've never heard this before. The topic of addiction and addiction treatment has brought up from time to time from public and government officials, yet very few politicians and decision makers have addressed the issue with any sort of authority. Today, the Surgeon General released an official report which highlights just how bad addiction crisis is in America. In his report, the Surgeon General touches on an issue such as prevalence of addiction in America, the treatment gap, and the mental health issues associated with addiction. I will cover this subject in detail over the next days and weeks ahead. But first, I find it more appropriate to display or speak of the summary of the report in this video. This is word for word and has been copied directly from the Surgeon General's website onto my teleprompter for me to read to you. Times are changing. Let's keep showing the world that recovery is possible and keeping extended ourselves to helping one another. You can find the original report or the original summary, as well as links to the full report at addiction.surgeongeneral.gov/executive/summary. Executive Summary Surgeon General's Report on Alcohol, Drugs, and Health. In 2015, over 27 million people in the United States reported current use of illicit drug or misuse of prescription drugs, and over 66 million, nearly 1/4 of the adult and adolescent population, reported binge drinking in the past month alone. Alcohol and drug misuse and related disorders are major public health challenges that are taking an enormous toll on individual, families, and society. Neighborhoods and communities as a whole are also suffering as a result of alcohol and drug-related crime and violence, abuse, and neglect of children, and the increased cost of health care associated with substance misuse. It is estimated that the yearly economic impact of substance misuse is $249 billion for alcohol misuse and $193 billion for illicit drug use. Despite the social and economic costs, this is a time of great opportunity. Ongoing health care and criminal justice reform efforts, as well as advances in clinical research and information technologies, are creating new opportunities for increased access to effective prevention and treatment services. This report reflects our commitment to leverage these opportunities, drive improvements in individual and public health related to substance misuse, use disorder, and related health consequences. Most Americans know someone with substance use disorder, and many know someone who have lost nearly a family member as a subsequence of substance misuse. I know most of us have. Yet, at the same time, few other medical conditions are surrounded by as much as shame as misunderstanding as substance use disorders themselves. Historically, our society has treated addiction and misuse of alcohol and drugs as symptoms of moral weaknesses or as willful rejection of social norms, and these problems have been addressed primarily through criminal justice system. Our healthcare system has not given the same level of attention to substance use disorders as it has to other health concerns that affect similar numbers of people. Substance use disorder treatment in the United States remains largely segregated from the rest of the world and the rest of healthcare, and serves only as a fraction of those in need of treatment. Only 10% of people with substance use disorder receive any type of specialty treatment. Further, over 40% of people with substance use disorder also have mental condition, yet fewer than half, exactly 48%, receive treatment for either disorder. Many factors contribute to this treatment gap, including the inability to access or afford care, fear of shame and discrimination, and lack of screening for substance misuse and substance use disorders in general healthcare settings. Further, about 40% of individuals who know they have alcohol or drug problems are not ready to stop using, and many others simply feel they do not have a problem or need treatment, which may be partly be a consequence of neurobiological changes that profoundly affect the judgment, motivation, priorities of a person with a substance use disorder. This is a quick roundabout summary of his released information. Go to the website I mentioned above. If you need to have the exact address again, you can email me at Ralph@TakeYourLifeBackToday or you can call me at 844-405-HELP. Drugs in America, alcohol in America, are at an all-time high crisis. We all have had someone in our family that has been lost. We all definitely have somebody that has some sort of alcohol or drug issues in our family. It is up to all of us, with the grace of God, to help each other. Let today be the first day where you start helping your fellow man. Let today be the first day that you extend an arm, a hand, and saying, let me help you. And may God bless each and every one of you, and may you all have a very, very happy Thanksgiving.